The idea of getting healthy seems easy enough. Eat well, exercise, drink lots of water, and get plenty of sleep. But what many may not know or really understand is the role that social factors can play into getting and staying healthy. So to talk more about the social determinants of health today are Idaho Food Bank Community Initiatives Director Megan Seal, as well as Director of Provider Relations with Optum Idaho, Matt Johansson. Thank you both for being here today.
Thank you. Thanks for having us.
Of course, my pleasure. So very, very important topic today. And I wanted to start with, this is something that I think a lot of people don't know about, like I was saying just a moment ago. How, Megan, would you say a lack of access or I should say just having access in general to nutritious foods, how can that impact Idahoans' mental health?
Well, what we see, unfortunately, is really a vicious cycle with food insecurity and chronic diseases, including mental illness and mental disease, where an individual or a household might experience food insecurity, and with that becomes negative coping mechanisms. So they're no longer able to get their stress relief through, exercise or eating well. It's just a very stressful situation in general, and from there we see an onset or an exacerbation of a chronic disease or an illness. And with that, we see an increase in medical expenditures, a decrease in employability, and families are having to make really difficult trade-offs. So do I go to the doctor this month? Can I go to my therapy appointment? Or do I put food on the table? Or can I pay for my child's lunch bill? And it just really makes that cycle continue. So we like to step in and say, let us provide the food, take care of yourself, take care of your health, and we'll make sure that we can get something nutritious on your table tonight.
Yeah, that's great. And that's something that I think not a lot of people really understand if you're not going through it, is you just think, oh, people don't have enough to eat. They're just hungry. Not everything that comes with it. Matt, you want to add anything?
Yeah, absolutely. And Megan did a great job of identifying kind of how food insecurity, the lack of access to nutritious food can impact, adults and those of many age ranges. But I think it's important to identify what it does to children, right? Children and adolescents. With the increased focus placed on the impact of food on mental and physical health over the past, 10, 20 years. We've seen a lot of, very concerning studies about the impacts with children and their ability to function in school. Kids that have been identified as food insecure have been found to have higher instances of aggression, anxiety, depression. They have difficulty developing social skills, difficulty developing linguistic skills. It's pretty dark. And unfortunately, as those kiddos get older, it gets a little bit even more concerning. We find that those individuals that, those young adults, those adolescents that are food insecure are at higher likelihood of experiencing suicidal ideation, thoughts of hurting themselves. They're 5 times more likely to attempt suicide. So I don't think it can be understated the impact that food has with, basic mental health and mental health complications.
Yeah,
absolutely.
That all makes sense. Oh, go ahead.
Oh, I would just add, I think Matt touched on a really important topic and just kind of the difference between hunger and food insecurity.
Okay.
Because they are really different. Most of us at one point or another have experienced hunger, and that's a physical sensation of having gone too long between meals. But as Matt said, food insecurity is the lack of consistent access to nutritious foods. And with that, food insecurity is really where we start to see the big impacts on overall whole health.
Okay, gotcha. Now, let's get pretty hyper local here, or at least statewide. How would you say, Megan, that this issue is unique here in Idaho?
Well, Idaho is a lot of rural territory across our state. We know that we experience a lot of rurality, and food insecurity actually disproportionately impacts rural communities. So if we look across the entire country and even across the state of Idaho, we know that the majority of the state is not living in rural areas, but that those individuals that are in rural areas are experiencing more food insecurity. So harder to access consistent food, harder to access services such as mental health services. So just a lack of access all around. One of the things that we try to do is we have the opportunity through our network of food distribution partners to serve about 184,000 Idahoans every month.
Wow, every month. Wow, that's great.
Yes. So through that net, we have the ability to get lots of resources out into the community. So we've done some work where we partnered with 988, the Idaho Crisis Suicide Hotline, to get information out to those rural areas so that folks that are passing through those pantries that are at an increased risk of experiencing, as Matt said, suicidal ideations and other mental health challenges have access to those resources.
Wonderful. Matt, anything you'd like to add to that?
No, Megan hit it on the head. I don't think I can add anything. Do want to point out that Idaho is, sometimes we think it's 3 different states at times, right? We're just so geographically diverse, and that does create unique challenges with accessing affordable, nutritious food.
Gotcha. That all makes sense. Okay, Matt, let me ask you, what exactly is SDOH?
So SDOH stands for Social Determinants of Health. Down to brass tacks definition, it is the definition, is the factors, the non-medical factors that impact health outcomes. So the conditions in which somebody is born, their conditions in which they live, they age, they work, they go to school. All those factors have a part to play in our physical health and our mental health. And it has really gained steam, like I've said, over the past 10, 20 years. Some examples of those social determinants of health, I think the CDC goes by, 5 of them. I always forget one, so please fill it if I forget one. It's access to quality education, access to quality health care. It's your neighborhood and physical living environment, your social and community context, how you interact with those in your community, how you interact with those in your family. Are you able to create stable relationships, and economic stability, which we're talking about right now, because access to nutritious food, like the Idaho Food Bank helps with, and food insecurity falls underneath that economic stability.
Gotcha. Anything you want to add to that, Megan?
One of the ways that we like to talk about the social determinants of health and really kind of think about the social determinants is creating conditions where all Idahoans have the opportunity to thrive or be well, because that's what we're all really looking for. We want healthy communities. We want everybody to have these conditions in which they can live their best lives.
Gotcha. Yeah, that makes sense. Matt, let me go back to you and just ask, with these 5 domains of the 5 domains you were talking about, as stated by the CDC, how would you say they change the approach to healthcare, or specifically mental health care?
Oh boy, they've changed it quite a bit.
Yeah.
So as we've learned more about the social determinants of health, it's shifted the entire medical, mental health, and physical health communities and those providers on how they assess individuals. I think we can all identify when we go into a doctor's office, our primary care physicians, and we're filling out that stack of paperwork that's the size of an Ernest Hemingway novel or something. There are questions in there that relate to social determinants of health. Are you eating enough? How are you sleeping? Things of that nature that hit on those social determinants of health, because they're looking at the whole person now, the whole health. And in mental health, as a mental health provider myself, it has changed the way that we assess the individuals coming in for depression, for anxiety. Gone are the days of somebody coming in to seek treatment for depression and only those symptoms of depression being assessed and treated. It is now common practice and best practice to look at the whole individual, look at their family situation, look at their family history, look at their physical environment they're growing up in, things of that nature, so that you can treat as I said, the whole person. And I'd be remiss if I didn't mention that it has created a kind of a light bulb moment for mental health and physical health practitioners, that the research suggests that if there is something wrong, or there is a red flag raised for somebody as far as social determinants of health, the ship can be righted. It can be corrected, but the key is catching it early. Right? Catching it when they're relatively young, and that individual can be connected with great community resources like the Idaho Food Bank to fill some of those needs. The powerlessness comes to some of the healthcare professionals when we see, well, these kids or these adolescents, they're getting assessed at the doctor's office, they're getting assessed at a community mental health center, but as we all know, not all kiddos go for regular checkups. Not all of them are in counseling. So we're more and more reliant on those other community resources, the schools, the coaches, the churches, the Boys and Girls Clubs of the world, to help us in identifying those kiddos at risk and get them connected with the right resources.
Yeah, great stuff. Megan, anything you've seen you want to add to that?
No, I would just say that we're so thankful for awesome supporters and collaborators like Optum, who really are moving this forward within the healthcare industry and are being the trailblazers and saying, no, you really do need to pay attention to these social determinants of health, and it will have an impact on the health of our entire state.
Great, awesome. Now let me go back to Optum for a second, Matt. How would you say Optum Idaho is working to remove those barriers in relation to mental health and food insecurity?
Yeah, Optum Idaho promotes kind of the whole health, the whole person, mantra to well-being. And in partnership with with the Idaho Food Bank, we've launched for the month of May the Idaho 50K contribution campaign, challenge campaign. And if you go to idahofoodbank.org/Optum50K and donate through there, Optum Idaho will match those donations of up to $50,000.
Wow, that's great. A lot of good stuff there. All right, well, anything else you both want to add today about SDOH or food insecurity or anything else here in Idaho that we should know?
I don't think so.
No.
Yeah.
Okay.
Thank you so much for having us.
Yeah.
Of course, yeah, this was great information. Really appreciate you being here, and especially with an issue that I don't think a lot of people really know or think about unless it's happening to you. So great stuff. Thanks so much.
Thank you.
All right, and of course, joining us today to talk about the social determinants of health have been Idaho Food Bank Community Initiatives Director Megan Seal, as well as Director of Provider Relations with Optum Idaho, Matt Johansson. Again, thank you both for being here and the wonderful information.
Thank you.
Thank you.